Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuveer Deshpande from Pune, Maharashtra State, would like to welcome you all in the class of Prasuti Tantra Stri roga. This is the subject, for example, gynecology and obstetrics. Of course, Ayurvedic students, BAMS. Then third BAMS, they have this particular subject, that obstetrics and the gynecology. Paper 1 is related with the pregnancy and the delivery and the post-delivery type of the things. And in the paper 2, actually the gynecological problems they have taken. For the paper 1, just now my student has explained me some of the titles of the chapters. The same thing I am going to discuss for all the students who are listening or who are seeing this particular video. So my dear friends, in the paper 1, there are some chapters. For example, number 1, Garbha Vijnaniya. Garbha Vijnaniya. There we can understand the Garbha Dhana Vidhi, Garbha Sambhav Samagri, Garbha Masanumasika Vriddhi, Apara Nirmiti Placenta, and Garbhodaka, amniotic fluid. So these are the important topics in first chapter, that is Garbha Vijnani. Some parts we have already discussed in the previous video, you can check that. Second chapter from this paper 1 is a Garbhini Vijnani. Pregnant lady. Garbhini is a pregnancy, pregnant. So that pregnant lady, Garbhini Vyakhya. Why I am always in each video repeating this particular chapter names, syllabus, questions, because the terminology is very important. And then you can revise, okay, shall I remember the Garbhini definition, etc., etc. Then Garbhini, Nidan, Lakshana, pregnancy symptoms. That is called as a Vyakta Garbha Lakshana. And in this chapter, there are also Garbhopaghatha Garbhav. I am telling you only important points. So whatever I am telling you in this class, go open your textbook and start making the notes of your own, because Deshpande sir classes will give you the confidence. Some give you the direction how to study, but you have to prepare your own notes. You can definitely send it to my WhatsApp just casually. Sir, please have a look and check whether it is going okay or not. So chapter 2, Garbhini Vijnaniya, there is a Garbhopaghatha Garbhav. Third chapter, Garbha Vyapad. Vyapad is always complication. Garbhastrava, miscarriage. Garbhapat, abortion. Upavishtak, Nagodar. That we have already video done. Leena Garbha and Mruta Garbha, intrauterine death of the fetus. Next chapter, chapter number 4, that is actually only 2 points will be on the screen, but remaining things you have to just carefully listen what Dr. Deshpande is explaining by audio. Okay, so first we will see the important topics. There are different upadravas because of the pregnancy during the gestational period. During the pregnancy 9 months, some problems will arise, and when the pregnancy occurs, delivery occurs, everything goes away. 99% goes away. Sir, why this? I will give one example. Some ladies during the pregnancy, they get diabetes mellitus, madhumeha. That is called as a gestational diabetes mellitus. Gestational during the 9 months. Actually, what I have said, that after delivery, diabetes should go. But in some ladies, that gets converted into the regular maturity onset diabetes mellitus, that is type 2 diabetes mellitus. I don't know, but because of some improper diet, improper lifestyle of that pregnant lady, in very 1 or 2%, after pregnancy also the diabetes continues, but very exceptional. But otherwise, all other problems, they go away after delivery. So this is a, for example, Kashyap, you know the Kashyap, the Prasuti Tantra scientist, Kashyap. Kashyap has mentioned some Garbhopadrava that we are going to see. Harita is also one of the scientists, Rishi in Ayurveda. That Harita has explained more, what you can say, the practical Garbhopadrava. That's even today we can see that Garbhopadrava. Okay. Then Garbhopadrava Shoth, edema occurs. Leg edema, whole body edema. That is Garbhopadrava Shoth, edema. Chardi, vomiting. Hyperemesis gravidarum. During the first 3 months, hyperemesis gravidarum. Pregnant lady gets vomiting. Then there is a Garbhopadrava apasma, epileptic fits, epilepsy. Garbhopadrava jvar, pyrexia, fever. Garbhopadrava vaivarnya, because of the anemia. Anemia is a pandu, or kamala, jaundice can also take place. Then Garbhopadrava prameha, diabetes mellitus. Garbhini udavarta. Garbhopadrava makkal, typical name makkal. I will tell you what is that makkal. Garbhopadrava yoni samvarana. Bahu apatyata, anek apatyata. Same words. Bahu apatyata or anek apatyata. Twins or triad, 2 children, 3 children in the uterus, that can occur. Bahu means many. Apatya, progeny, babies. More than 1 babies. Bahu apatyata. Garbhashayetar garbhadhan. That pregnancy doesn't take place in the uterus as a normal. It can take place in the fallopian tubes. Oh my God. In the abdominal cavity. That is called as a ectopic pregnancy. Ectopic pregnancy. So this is our basically, today we are going to concentrate Garbhopadrava. But again, the next chapter, Prasava Vijnana, where we must know about the delivery process, how the delivery takes place, how much time, avadhi, kal, garbha asana, posture of the fetus. That is called as a lie, L-I-E, lie. Then Prasava Avastha, where there is a Prajayini Avastha, then Avi and Prasava Vedana, labor pain, Prasava Vedana. Next chapter, 6th, Prasava Vyapad, Akala Prasava, Kalatita Prasava, Prajayini Avastha, Vilambita Prasava, delayed, Vilambita, then Garbhasanga, Aparasanga, Apara is a placenta, Prasavottar Yoni Bhed, Prasavottar Raktastra, post PPH. Then Krutrima Prasava Vidhi. Next chapter, Sutika Vijnan. Sutika, pregnant lady is another, and Sutika is after delivery. The lady is called previously, before 9 months, Garbhini. After 9 months, after Sutika. Garbhini, Sutika. Garbhini, Sutika. Don't forget. Before 9 months, Garbhini. After 9 months, Sutika. Sutika Kal, Sutika Paricharya. Okay. Then next chapter, Sutika roga. Diseases can take place. For example, what is the Sutika roga mentioned in the Samhita Granthas? Sutika jvar, fever. Sutika shoth, edema. Sutika makkal. Sutika vidradhi. Rakta vidradhi. One of the point is here, Rakta Gulma is similar to Rakta vidradhi. Then Mudagarbha, next chapter, Mudagarbha. Mudagarbha Vyakhya, Samprapti, Samanya Lakshana, Prakar, Trividagati, Ashtavidagati, Sadhya Sadhyatva, etc. And last chapter is Kutumba Niyojana, family planning, family welfare concept, national family welfare programs in India, family planning, contraception, for example, oral contraceptive pills. Pill is a tablet, OC pills, birth control, then the scope of family planning services, okay, and Ayurvedokta Garbha Nirodha. So these are the general idea. Now let us start about the direct today's lecture. You write down 2 things are mainly we are seeing. First is open your notebook, date, serial number, 5th of December 2023. The topics is first is Rakta Gulma, like a tumor, and then we are seeing the Bahu, multiple pregnancy, Bahupatyata. These are the main topics that we are discussing. Okay. So as usual, I will mark the particular topic and then we will see. Okay. Rakta Gulma. Okay. Like a growth or the tumor. When the aggravated Vata dosh, is localized in the abdomen, it causes swelling associated with shul. Vata is always pain. Whenever Vata dosha is there, there is always pain, resulting in the formation of Gulma. Okay. Rakta Gulma is a type of Gulma which occurs specifically in the woman. Okay. What is the causes? First is a fasting during the Rutukala. During the previous menstrual cycle, too much fasting is there. Then bhaya, fear, something, phobia. Oh, a lot of tension. That is bhaya. Ruksha, annapana, dry substances, not taking milk, not eating with some ghee, beverages, for example, curry, buttermilk, not taking anything, no liquids, water is drinking less, rukshata will come up. And vega nigraha, that is vega dharan. Whenever we want to go to defecation, urination, we should not stop the urge. That is natural urges. Ayurveda is saying, don't stop natural urges, don't create it forcefully. Vegan dharayet, vat, wind, mutra, kshavat, trichudam, nidra, kasa, shrama, shwas, jurumba, shru, chardireta, sam. Ashtanga 13 Vegas are mentioned, natural urges. That you should not, anybody should not stop. But if this lady is doing that, then she will get Rakta Gulma. Stambhana, Lekhana, for example, improper administration of Stambhana, dravyas like Kashaya Rasatma, astringent, too many astringent things if the lady is taking. And Vabana Karma. So improper administration, that is more important. If you do very properly, Samyaka Lakshan are there, no problem. But if improper, then Rakta Gulma can occur. Yoni dosha, disorders of genital organs. Okay. So what will happen? Rakta Gulma Lakshana. Rakta Gulma symptoms. First, Gulma is like tumor. It may be benign, it may be malignant, it may be uterine fibroid, anything. It may be cyst, anything. All things can we consider as a Rakta Gulma for the practical purposes. Pindita is some shape, rounded shape. Spandate. Pindita spandate. There will be pulsations. Palpitation, it's a pulsation of the round mass. Then Sama Garbha Linga. Symptoms like pregnancy. Actually, it is not pregnancy. It is not pregnancy. But all the symptoms are, because during the pregnancy, that lady has some baby inside in the uterus, baby, okay? Here baby is not there, but something abnormal mass is there, tumor is there, growth is there, and because of that tumor, it is creating the symptoms like pregnancy, but it is not pregnancy. There is not pregnancy. Remember this thing. So, Artava Adarshan, here you can see cursor, symptoms like a pregnancy. It is not pregnancy. Okay. Artava Adarshan, that is amenorrhea, no menstrual cycle. Hormonal changes comes up. Then Asya, excessive salivation. Lalastra will be there, excessive salivation. Then dislike of the food. Anannabhilasha. Sanskrit words are there. If you can remember Sanskrit word, okay, 1 or 2 or 3, that is also okay. Don't take tension that I should remember each and every Sanskrit word. Not necessary. Not necessary. 1, 2 word, remember, write down. But otherwise you can translate amenorrhea, excessive salivation. Chardi you can remember, very easy word, chardi. So chardi, you write down chardi into bracket vomiting. Then arochak, you can understand, very easy word, anorexia. Then craving for sour substances. Amla is a source. Kamata, desire. I want the mango pickle, raw mango. I want to eat raw mango. Such a desire will come with that lady. Then heaviness in the body, that is guru gatratva. Guru means heavy. The next, languor in eyes, glani, like a drowsiness, feeling sleepy, like a sleepy. When I, for example, I will remove my, see, chakshusha glani. My eyelids are drooping down. Can you see? I cannot give the lecture because there is a chakshusha glani. So this is the action, so you will remember chakshusha glani. Hangover, like a drowsiness. Then milk secretion, stanya will come. Then pedal edema, pad shvayathu. Shvayathu is a shoth. If you are ready, please write down because this word is important. Shvayathu. Shvayathu, edema. Write down, edema. Shvayathu. Then hyperpigmentation of lips and areola. Okay. So here Karshnyam, Atyartha, very much dark color will be there. Where Oshta and Stana Mandala. Areola, Stana Mandala. Okay, some Ayurvedic words also you try to remember. Now we will go for Chikitsa. Rakta Gulma Chikitsa. Give the title. At least you write down the keywords, very important words that you must remember. I will wait. Write down Rakta Gulma Chikitsa, that is treatment. First thing you have to write Rakta Gulma occur here, cursor. See the cursor. Only in women and should be treated only after the completion of 10 months. That means actually this is a Samhita Grantha's understanding. Personally, what I feel nowadays, there may be surgical intervention before that also. That particular understanding, they may be thinking in another way, that let it has a full growth, don't remove in immature form, something like that. But nowadays, you have a lot of investigations. You can do the sonography. You can do the whatever, different blood test. And then if the surgically the lady is fit, you can take out that gulma. There is no problem. But at that time, that Samhita Grantha time, they were telling that wait for 10 months. Nowadays, I don't think that any gynecologist will wait for 10 months. Okay? But you have to write down the Samhita in the examination. So always Vata is Snehan and Svedan. Oiling, ghee internally, oil externally. Simple. This is Snehana and Svedana, fermentation. This followed by Sneha Virechana. You have to use the purgation, laxative, simple laxatives. For example, Trivrut, Nishottar, Leha. Write down Trivrut Leha. You can use Trivrut Leha. Jam, it's like a jam. Then Kshara Prayoga. Prepare a semi-solid preparation by heating 1 part of Palasha Kshara, alkali, Parasa Kshara, 1 part of Ghrita and Taila. Administer it in sufficient dose to soften the Rakta Gulma. Again, I am saying these were the policies at the time of Samhita Granthas. Nowadays, different management can happen. Then Yoni Shodhana. What you can do? That is sesame paste you can do mixed with a kshar, alkali. Palala mixed with Sudha Kshira, Nudung, Marathi Nudung. It's a very strong plant having the Ushna Virya, Snuhik Kshira. Next, Dashamula Siddha Basti Prayoga. Dashamula is the best 10 roots, 10 herbs, 10 roots. This is the best anti-vata. I know in your also practice, always whenever the arthritis patient will be there, very interesting, always prescribe Dashamula Arishta. Rheumatism, backache, knee joint pain, any joint pain patient, arthritis patient, please, Dashamula Arishta is the best medicine. 4 teaspoon medicine, add 4 teaspoon of water, equal quantity, and give it after lunch and after dinner. Best results. Dashamula Arishta. Remember arthritis. Because there is a Vata problem. Similarly here, Rakta Gulma, Vata problem is there. So, Basti, Dashamula. Basti prepared with Kshira, Mutra, Kshara, and Dashamula Kvat should be administered. Dashamula, Bruhat Panchamula, and Laghu Panchamula. Just I remember immediately, so I am telling you, Shaliparni, Prashniparni, Bruhati, Kantakari, Gokshura, Bruhata Panchamula. Big roots, big 5 roots. Shaliparni, Prashniparni, Bruhati, Kantakari, Gokshura. And Bilva, Agnimanta, Shonak, Patla 10 to Laghu Panchamula. Don't take tension. Repeatedly see the video. If you can hear, write down one after another. Take a pause, write down. Take a pause, write down. This is the policy you can adopt for the any YouTube video. Okay. Rakta Gulma does not subside and flows out of the yoni, then Shalya Karma is required. Something wrong things happen with the Shamana Chikitsa, you can go for surgery. Okay. Sometimes this Rakta Gulma question is asked, so I have taken this for today's discussion. Okay. That is not a much practical sense, according to me, for this specifically Rakta Gulma. Nowadays, nobody will treat any tumor with this method, as per my knowledge. Okay. Then multiple pregnancy, that is Bahupatyata. Let us mark so that you can concentrate over here. Concentrate, focus. Okay. According to Charaka, Shukra and Artava, you know that, male gamete and female. Shukra and Shonit, spermatozoa and ovum. That when they meet, what is happening? Fertilized ovum. Can you see here? Fertilized ovum. Entering the Garbhashaya. When it enters into the uterus, is divided by the excessively aggravated Vayu. That whole product is divided. And number of Garbha corresponds to the number of division which is under the influence of deeds of previous life. Ayurveda is believing rebirth therapy, rather rebirth theory, not therapy. Theory, Theory. We have the past life, present life, and we have also Punarjanma, next life. This is Ayurvedic concept. Whether you believe or not, but yes, Ayurveda says that we can carry the things that we have did in the past life, that we have to what you can say, enjoy or suffer with these particular deeds. So past life, present life, future life, rebirth theory is according to Ayurveda. Okay. According to Sushruta, the Antah Vayu. Again, Vayu is important. Please write down in your notebook. When we talk about multiple pregnancy, also in the Rakta Gulma, Vata dosha is important. This much you must know. Vata dosha. Okay. Rakta Gulma, you mentioned as a tumor. Now here multiple pregnancy. Normally one baby should come. But if they are twin, जुळी मुलं मराठीमध्ये आम्ही म्हणतो, जुळं झालं जुळं. So 2 babies are there. Then maybe 3 babies are there. I have heard very astonishingly something more also. But usually 2 or 3 are the normal. Beyond that, it's like a miracle. Okay. So Antavayu divided the bija, that is embryo, into 2. Then 2 jiva enter the kukshi, that is uterus, and twins are born depending upon dharma or adharma. Hence it is called as a dharma tara sarau. Something complicated word, you forget about that word. Okay. Then according to Acharya Vagbhat, based on the number of division of Vayu, corresponding number of fetuses are formed. But the most important thing you write down is a Vayu. What you can say, the Vayu is the main reason for multiple pregnancy. Okay. Okay. Just we will go further and see the details. Okay. Charak has said, due to the predominance of Rakta, a female child is conceived. Due to the predominance of Shukra, a male child is conceived. Dominance of Rakta gives the female child. Dominance of Shukra gives the male child. In case of Yamala, that is twin pregnancy. This word is very important because it will be asked during the oral. So I am saying this word 2 or 3 times. Write down, please start writing. Cursor is there. Can you see cursor? That here, this is the cursor. Yamala. Devanagari script, English, write down. Yamala is equal to twin pregnancy. Yamala is equal to twin pregnancy. Write down, I will wait. Yamal, very important term, Yamal, because there will be SAQ, describe Yamal. So you will not know. So Yamal is a twin pregnancy. Okay? Yamal, twin pregnancy. The sex of the children depends on the manner in which the Vayu divides the bija. One part has predominance of Shukra and other part has a Artha. So one male and one female child is conceived. If both parts, divided parts, have the predominance of Shukra, then both the twins will be male gender. If both the parts have the predominance of Artava, both the separated parts, then that twins will be female in gender. Very simple to understand. Okay. Then, next, Vayu, according to one's deed, divided the bija unequally, resulting in unequal growth and development of twins. That means if there are two babies, one baby's growth will be normal, another baby may not grow as that much normal. Okay, the child from the bigger portion will be healthier and stronger, and one, because there are two parts, one part who is a smaller, that can be the weaker child, weak child. So even in the twins, their whole life process may be different. One may be very strong and stout, and another may be in beginning or in afterwards also it can be weak. So I think, my dear friends, although we have a lot of time, and I am going to tell you the lot of things, but these two things you have accepted, that multiple pregnancy Dr. Deshpande has mentioned, and it is because of the Vayu, and also bija is divided, etc. And here you have also seen about the Rakta Gulma. Now, a little type of dictation, you can say. Start writing. Slowly and steadily, I will dictate you another important things, that is regarded Garbhopadrava. Please give the title Garbha, Garbha Upadrava, Upadrava, Garbhopadrava. Garbhopadrava. Upadrava is like complications. Write down complications during the 9th month. During 9th month. That is Garbhopadrava. Now, don't write, just hear. Upadrava. In the Roga Nidana subject, there is a separate chapter of Upadrava. What is exactly Upadrava in the Roga Nidana subject? Upadrava, don't write. Roga Arambhaka dosha, Roga Arambhaka dosha, Prakopajanya Anya Vikara. Two times I will say. Upadravo, Roga Arambhaka dosha, Prakopajanya Anya Vikaraha, Madhukoshtika. You know the Madhava Nidan, best textbook of Roga Nidan, and Madhukoshtika, explanation on that text. So, for example, I have the fever with the Pitta dosha. So I have the fever. Jwara, you write down this example, Upadrava. I have the fever, but after that Pitta Prakop is so much that I will start Atisar. Atisar, loose motions. So basically I have the viral fever. But in that viral fever, I started Atisar because my Pitta is too much. Here, Roga Arambhaka dosha Prakopajanya Anya Vikar. Anya is a separate. So this is the definition of Upadrava. Now, again dictation. What is Garbhopadrava? Please write down. Garbhasya Upadravaha. Garbhasya Upadravaha. Now, Garbhini, I am talking about Garbhini, pregnant lady. There is first 3 months, please write down first 3 months, that is called as the first trimester. First trimester, write down. Kapha Adhikya. There is a predominance of Kapha in the first 3 months of pregnancy. Next, 4, 5 and 6 months. What is that? Second trimester. Write down. Second trimester. Write down. Pitta Adhikya. Pitta Dosh Adhikya. Next, 7, 8, 9 months. That is the last trimester, third trimester. Write down. Vatadhikya. Vatadhikya. Okay? If during this whole period, if the pregnant lady takes a bad food, improper, dosha prakopak ahar vihar, which will stimulate the dosha prakop, then there is a chances that she will suffer from garbhopadrava. But in addition to that, please write down, in addition to that, the dosha sanchiti will occur. That means now it may be danger at some time. Then when the pregnancy, baby is there, garbha is there, because of the garbha dosha, please write down, because of the garbha dosha, this vata pitta kapha, which was normal in the pregnant lady, that becomes havoc, like a too much. And then all the material, that particular vata pitta kapha prakopa, too much kapha prakopa, will move in the body and find out the sthana vaigunya. This is related with roga nidana, sthana vaigunya, and there they will attack and the vyadhi will start. This is, I am giving you the samprapti. Please write down. Samprapti of garbhopadrava. Samprapti, pathogenesis of garbhopadrava. Now, I am giving you the number. Please write down the number. First, I will give you the references of garbhopadrava. Please write down. Dictation. Dictation. References. References for garbhopadrava. Number 1. Write down. Number 1. Charaka Samhita Chikitsa Sthan. Charaka Samhita Chikitsa Sthan, chapter 14, 1-4. Next, second, next line. Sushruta Samhita. Sushrut Samhita Nidan Sthan. Nidan Sthan, chapter 1. Next, third reference, next line. Ashtanga Rudaya, that is Vagbhat. Ashtanga Rudaya, Nidanasthan. Nidanasthan, chapter 7. Chapter 7. Next line. I am telling you the references of Garbhopadrava. Kashyap Samhita. Write down. Kashyap Samhita, Khilasthan. Khila, K-H-A. Khilasthan, chapter 10. Kashyap Samhita. Next line. Harita Samhita. Harita Samhita. Tritiya Sthan and Chikitsa Sthan. We are talking Garbhopadrava. Every after 2 minutes I will say Garbhopadrava, Garbhopadrava. So, please write down. Please write down. There are basically in Harit Samhita, because in the examination they will specifically ask. Write down the 3 marks SAQ. 3 mark SAQ. Write down the Garbhopadrava mentioned in Harita Samhita. I am giving you the names. I am giving you the names. Please write down. There are 8. Harit Samhita 8 Garbhopadrava. Please write down. Number 1. Number 1. Shosh. Shosh, like a dehydration, undernourishment. Shosh. Number 2. Rullas. Rullas. Rullas, nausea. Like feeling of vomiting. Rullas. Number 2. Number 3. Number 3. Garbhopadrava by Harit. Chardi. Chardi, vomiting. Chardi. 4th. Shof. That is shoth. Shof, shoth. Next. 5th. Jwar. Fever. Next. 1, 2, 3, 4, 5, 6. 6th. Aruchi. No test. Aruchi. Anorexia. Next. Atisara. Loose motions. Diarrhea. And Vivaranatva Pandu. Anemia. So these are 8 upadrava, that is Garbhopadrava, mentioned by Harita. Is it clear? Okay. Let us move further. So, some common problems that are occurring as a Garbhopadrava in pregnancy. First, you write down Chardi. Chardi is equal to, in the modern science, obstetrics, they say hyperemesis. Write down HYPER, hyperemesis, EMESIS, hyperemesis gravidarum, 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 hyperemesis gravidarum. Okay. Usually, this occurs in the morning time. This occurs in the morning time. And automatically, after 3 months, that will go. That will go automatically. Okay. So, basically, what are the causes? Just now I have said Garbha Pida. Garbha Pida. Problem with the fetus. Problem because of the fetus. Baby. Garbha Pida. Number 2. If the pregnant woman takes lot of fatty substances, please write down fatty substances, or too much sour, SOUR, amla padartha, then some which she do not like, arudhya padartha, some bad scenes she is seeing, vibhatsa darshana, then eating stale food, physical or mental tensions. Okay, so even sometimes acidity, worms in the abdomen. So all these are causes the vomiting. That is hyperemesis, Garbhopadrava Chardi. Okay, so because of the Nidana Sevan, because of the, I am telling now you Samprapti. Please write down Samprapti. Because of the Nidana, these are the causes that I have discussed. Because there is a Udana and Vyana Vayu Prakop. Udana taking out Udana and Vyana Vayu Prakop. And also Kapha Pitta Prakop. Because of the Vayu Prakop, there is a Vilomana. Anulomana is a normal track, peristalsis, but anti-peristalsis, Vilomana. Urdhva will, for the food, and everything will come out. And because of the Kapha Pitta Prakop, there is a stomach irritation. Stomach, Amashek Shobha will be there. There are many types of the Chardi. You just write down the names. Vataja Chardi, Vataja, because of Vata predominance. Pittaja Chardi, Kaphaja Chardi, Sannipatika Chardi, etc. What can be the treatment? First, Nidana Parivarjanam. Nidan, causes should be avoided. Don't take fatty food, don't take sour food, don't take irritating food. Okay? Then Anulomana and Shamana Chikitsa. And because of this vomiting, dehydration is common. So, oral rehydration solution, ORS, should be taken. ORS. Remember that. And then also you can give some, what you can say, the Laja is like a dry popcorns or the rice flakes. Laja churna can be taken. Then we can use, according to the condition, Amavastha, Sutta Shekhar can be used. Only very acidity is there, then Mauktika Bhasma can be used. And in the severe conditions, in our house, we can give the Shaharyatsa Pani, tender coconut water. We can give Limbu Sarbat, lemon juice. We can give the fruit juice, orange juice, etc. Sari Chalaya. But in emergency, we have to admit the patient and you can give the intravenous fluids, saline, for example. Okay? I am talking about Garbhopadrava, another Garbhopadrava, that is Shoth. Please write down. Edema in pregnancy. Edema. First causes. What are the causes? Firstly, the lady is already low weight, weak, already weak. And in this condition, she is eating beyond the capacity, adhyashana or viruddha ashana, incompatible food, viruddha anna. She is always taking viruddha anna. Then she is taking a lot of curd, curd. Okay. Then she is doing unnecessary and excessive exertion. That is called as the atishrama. Exertion is there. Then sleeping in the daytime, diva swap, sleeping in the daytime, and prajagar. At night, she is going to see the videos on the mobile, WhatsApp chat, Facebook, Reels, and sleeping late at night. That is also bad. So because of all these causes, what is happening? Now I am talking about samprapti. Please write down samprapti. Garbhopadrava shoth, edema. Garbhopadrava shoth. Nidana sevan. Then there will be vata prakop and also pitta kapha prakop and Rakta Vaigunya will be there. Remember, Rakta Vaigunya, problem in the blood, Rakta Dhatu. So, three things are there. Pitta, Kapha, and Rakta Dushti is there. And because of the stimulation of Vata, that Prakupita, all the bad things, they can go out of the capillaries, Bahissira, interstitial fluid. And there will be stagnation of that whole fluid. It cannot go out of the interstitial area, intercellular area, and that will accumulate over there. And then Tvak and Mausagata dosha sanchiti will be there. Under the skin, subcutaneous, and Mausagata. Dushti will be there, and automatically Shotha will be generated. This is the samprapti or pathogenesis. Okay. What are the symptoms? The main is a anavasthita shoth. It will be spread gradually, not at one place. It will spread for the whole body. Then gaurava, heaviness will be there. Weight will be unnecessarily increased. We are talking, my dear friends, garbhopadrava shoth. Okay. There are different types for vataja shoth, pittaja shoth, and kaphaja shoth. Okay. Vataja shoth is always pitting in edema. If you press on the legs, on the edema, there will be some what you can say, the pit will be there, and that will not heal up. It will not come up. Khadda padel tithe. Marathi मध्ये आम्ही खड्डा पडणं म्हणतो त्याला. So that is called as a vataja type of shoth. And kaphaja shoth will be little bit solid, non-pitting edema. So there may be pitting edema and there will be non-pitting edema. Okay, kathina sparsha. But here investigations are more important. Please write down. In any pregnancy edema, always do the investigations. The most important investigation is urine test. Urine test. And there you see whether there is a lot of proteins are there. If proteins are 3+, albumin is too much, that is a bad signal. Then you can also do the kidney function test, urea and creatinine. Urea and creatinine. One can do the liver function test, that is LFT. Also, we have to do the sonography. And most important is clinically, we must check the blood pressure. Very important. Because edema plus hypertension is very risky in pregnancy. Edema plus hypertension, very risky. So what we can do in this edema? The first thing, you have to give the lady full rest, Nidana parivarjana. Okay? And then another thing we can do, some tablets I am prescribing, please write down. Punarnava Mandur. Punarnava is a diuretic plant. Mutrala. Because of the urine, edema will come down. Punarnava Mandur, and Mandur is also very helpful to remove the to control the hemoglobin. Mandur Bhasma will increase the level of RBCs and anemia will go. Okay, so Punarnava Mandur is the best medicine. Chandra Prabha tablet, Gokshuradi Guggulu. And in the liquids, you can give the Punarnavasava, Dashamularishta. And in the diet, she should avoid the salty substances. Salt, without salt, no salt diet she should take. That is very essential because salt is hygroscopic and there will be lot of accumulation of the water, edema will increase. We are talking Garbhopadrava edema or Shoth. Okay. So buttermilk is good, green gram, mung is good, but she should avoid the curd or the fermented products. Uttappa, dhokla, she should not take. And then avoid the anger, tensions, and also sleeping in the daytime. Avoid everything. Okay. Next disease I am talking. Third, Garbhopadrava, very important for the practice. That is called as Garbhopadrava apasma. After every topic, you make some end line, end that topic, and now next dictation Dr. Deshpande is telling. Garbhopadrava apasmara, which can be compared with the modern obstetrics. Eclampsia. Yes, I am telling you the spelling. Please write down. E-C-L-A-M. E-E-E-C-L-A-M-P-S-I. Eclampsia. Eclampsia. E-C-L-A-M-P-S-I. Okay. So, apasmar will be there. That means whenever the Garbhopadrava Shoth is not properly treated, that can be converted into the apasmar. So, what is the samprapti? Nidana Sevan. And what is the Nidan Sevan? Same reasons like the Shoth, and also there may be some Sattva Rajatama imbalance. Sattva Rajatama imbalance, and the brain activities, electrical conduction in the brain is get disturbed. That's why, you know, in the epilepsy, EEG, electroencephalogram, is always done, but not necessary in the pregnancy because other parameters or other investigations are there. Okay. But base root cause of eclampsia is Garbhopadrava Shoth. So edema should be treated very quickly and very nicely. Okay. Whenever there is a hypertension, whenever there is a urine albumin in the pregnant ladies, it is warning you. The doctor should be very cautious. Okay. Experts should be treated. So Nidana Sevan is there in apasmar. Pitta, Kapha, Udana, and Prana. Four things are there. Pitta, Kapha, Udana, and Prana. That means these are the types of Vayu dosh. So Tridosh Prakop is there. Then also, in addition to that, as we are talking about brain, Raja Tama Vikruti. According to Ayurveda, yes, Raja Tama Vikruti. Then all these doshas, Prakupita doshas, they enter into the Shirasthana, Chetana Sthan in the brain. And then they cause Indriya Vikruti. Sensory and motor organs, they get disturbed. Sensory and motor organs. Indriya Vikruti. Then you write down these Ayurvedic words. I am dictating you samprapti of Garbhopadrava apasma. What next? Saudnyavaha srotas avarodh. Signaling, problems of electrical current, obstructing, disturbing the electrical current in the brain. Electrical current in the brain. That is Saudnyavaha srotas avarodh. Saudnyavaha srotas avarodh. And then fits, convulsions, unconscious, etc. The types, Vataja, Pittaja, Kaphaja, Apasmar. Okay. Of course, that whole symptoms I am not going to explain you, but there may be aura, there may be the convulsions, clonic and tonic, that we are also seeing in the Roga Nidan subject also we can discuss those things. Then Chikitsa is a two types. This is important. Garbhopadrava apasmar Chikitsa is of two types. First type is avegavastha and second is a vegavastha. So there are different ways to treat. Vegavastha means during the convulsions. Actually, Ayurveda says lot of things, but I personally not experienced much of these things practiced by Ayurvedic gynecologists. They are saying that you can do the Gudashunthi Nasya during the fits, but you can go to your hospital and ask the senior doctors whether they have doing this at moment, at this time. Exceptionally, 1 or 2% may be doing, but nobody is doing very actively Gudashunti Nasya during the Vegavastha. Then Pradhamana Nasya with the calamus powder. But in the examination, yes, I will agree that you have to write down, because this is a guidance from Samhita. We cannot deny that. We are not expert, that is our fault. It is not Samhita Grantha's problem. Okay, so you write down the Saudhnya Prabodhana Nasya is essential during the attack. Then in the modern pathy, they always give the injection Largactil. Injection Largactil they always give. Then injection Phenargan during the convulsions. Then also they maintain the fluid balance. Okay. And then Avegavastha, there are different things. You have to give the brain tonics. That can be done with the Ayurveda very well. We can do fantastic treatment. For example, we can use the Smruti Sagar Rasa, Brahmi Prash, Saraswata Arishta. All these things can definitely be used. Okay. In the last 5 minutes, I would like to explain again a very specific term, Garbhopadrava Makkal. Makkal, Makkal, Makkal. Sushrut Nidanasthan. Sushrut Nidanasthan, chapter number 8. Chapter number 8. What are the causes? But before that, I will tell you what is exactly the Lakshana, Makkala Lakshana. There is always a shul in the abdomen, that is pain in the abdomen. Then pelvic pain is there, backache will be start, glani, drowsiness will be there, anemic condition will be there. Okay. And when the doctor is examining, he is finding that there is a little bit enlargement at a region of the uterus, and sparsha sahat, tenderness is there. So this type of the serious pain and serious condition occurring, and afterwards that can problem with the child, baby. That child can die because of this Makkala disease, because there is spasmodic severe pain in the abdomen. That is a really Makkal. Tenderness will be there, little bit inflammation will be there. So what are the causes? If the lady is traveling during the first trimester, too much traveling with the motorcycle, with the rickshaw, and on the rough road, then there may be trauma on the uterus. Vega vidharana, too much fasting, dry food stuff, atiruksha, katutikta bhojana, very spicy, pungent, irritating food she is taking. Then there may be some problems like atisara, vamana, virechana, and wrong medicines are given. So all these make the little bit irritation, inflammation in the garbhashaya, and makkal. Makkal is really shul, severe pain, drowsiness, fainting, giddiness, and doctor is testing, the patient is, oh no doctor, please don't touch. Sparsha asatva, that is tenderness. Okay. What treatment is given? Shula shamana, analgesics, and rakta stambhaka, because sometimes bleeding starts. Rakta stambhaka treatment is given. Okay. And there sometimes it can converted to the different baby problems, like for example mrutagarbha, mrutajata, upavishtaka, upashishkaka. So all these problems can arise because of the Makkala problem, Makkala disease. I think we are nearly end of our topic, but another important Garbhopadrava I would also like to mention, that is a very common two problems. One is Garbhopadrava Vaivarnya, that is anemic condition, anemia during the pregnancy. So what are the causes? In Charak Chikitsa Sthan, again where Rakta Dushti will take place, like Ati Ushna, Ati Lavana, this type of the food stuff. Viruddha Bhojana. Some causes are everywhere. In any disease, you can write these causes. Okay. Then Vidagdha Avastha of the food, and the patient is sleeping. Immediately sleeping after food, after lunch, during the daytime is also problem that can create the erythropoiesis problem because of the digestion ama will be created. Then vyayama, excessive exertion, vega vidharana, psychological causes like kama, chinta, bhaya, krodha, and the most important is iron deficiency, vitamin B12 deficiency. That is called as a kuposhana. Huh? So what are the typical samprapti? First is nidana sevana, then pitta prakopa, rasadushti, less rakta portion because rasa is giving nourishment to the nutritious material to the rakta dhatu. Rasa dhatu is damaged, rakta dhatu will be damaged. Raktalpata, dhatu shaithilya will be there, dhatu tone, muscle tone and all these sarata will be disturbed. Then there will be loss of bala, strength, loss of varna, color and complexion will go, and loss of sneha in the body. While treating in anemia condition, Ayurveda says always use the medicated ghee. And I am telling you the Chikitsa. For example, you can use Tapyadi Loha tablet. Tapyadi Loha. Then you can give also the Loha Sava. Loha Sava, iron compound. Dadimadi Ghrita. Please write down. Dadimadi Ghrita is also the best treatment for treating this Panduvyadi. Then there are some Suvarnamakshika Bhasma you can give. If the appetite is less, then you can give the Drakshas also. So my dear friends, this is the time to conclude our lecture, and definitely we will continue the remaining things in the due course of time. But at the moment, I am taking your leave. Thank you very much. And tomorrow we will discuss about the pediatrics or Ayurvedic Kaumara Bhrutya Tantra. Thank you very much. Have a nice day or night, nice evening right now. Okay.